So we're nearing the end of the journey. At least we're getting the cues and clues that we're ending the journey. But don't assume families understand that. Many times they haven't really listened or heard or never even gotten information about what's this thing called dementia going to end up like. And so they're still looking for things to fix things. They're still asking us, well, what can you do? And of course, frequently we can do things, but the question is, should we do things? We're having to, at this point, to help families learn the art of letting go. Not giving up on people. We shouldn't be giving up either. But we're switching gears. We're really changing our approach. And we really want to be thinking about this because dementia is a little different than most other diagnoses. The journey's been long. And the person has changed and changed and changed and changed and changed. And so families think, okay, well, it's another change, but it's just another change. There have been so many. Additionally, people are really so changed that frequently the family members aren't feeling like they're caring for the person they've always cared for. This is somebody different. They lost the person they loved and they knew, and now there's this other person. And so there's already been a sense of loss. There's been a sense of grief in many cases, but now they're going to have to grieve again. And this is the final grieving. This is the real end. And so there's frequently this element of, well, am I giving up too fast? Am I just letting this happen? Because there's a sense of, well, I've let go of a lot. Is this real, or is this just another one of those kind of things? And how it should be is not how it's turning out. They're picturing these ends frequently where the person is going to be able to do what people at the end of life are able to do when they don't have dementia. And so they're not exactly sure. And sometimes people get clearer and sharper as they become more dehydrated and malnourished because endorphins are kicking in. But also frequently they start having episodes of delirium or confusion, and it's worse, and they're doing things that the family doesn't understand, and they're not doing things that they've been doing. So we really need to help families at this point. They've gone through a lot of changes. They've done health promotion for a period of time during the disease, and then there was cures. There were things that could fix some things. They weren't fixing dementia, but they were fixing the urinary tract infections, and they were fixing the upper respiratory infections, and they were fixing the arthritis problem, but that's not really where we want them to focus now. And there was a time when recovering from the hip fracture helped. And there was a time even when we maintained their weight and we maintained their movement and we maintained their activity level. And then there were times where we supported them and they were still able to do things. And now we're getting to a place in the disease where we seriously need to talk about comfort. How do we keep the person comfortable? What's right for them? Is it time to move away from everything but comfort? And we're talking about comfort of the spirit and comfort of the person, comfort of the emotion, comfort of the family, but comfort of the body, but not trying to fix things. And what families really need us to do is we need to figure out how to meet unmet needs, how to interpret behaviors, how to figure things out with detective work, how to cope without trying to fix things that can't really be fixed, how to help with challenging behaviors by helping us reduce frequency or intensity, but maybe not totally eliminating them, and coach those in support on how to do this, and that they're doing a great job, or how about if we try this, you did a really good job on this. They need support and affirmation because this is such a hard time to go through. So what happens if there are no words? Then you're learning how to use the body, the visual cues, the vocalizations. May be my norm. And then when somebody turns me to my side, Now, we want to look, was it the speed of the turn, the quality of the turn, or is it being on that side that's causing that level of change? So we do want to tune in to changes, but we can't always fix everything. But maybe we can reduce intensity. And it's not all about the medications. It's about how we do what we do and where the person is and how we help. So signs that we may be getting very close to the end include things like repeated infections that you treat and then they come right back. You may be upping the antibiotics over and over again. You may have a person who's refusing to eat. Even their favorite things they don't want. They just want to taste, that's it. They may hold the food in their mouth and pocket it and not move it around. You may be noticing that they have a real soft cough, but they're not really clearing anything, or maybe they're gurgly. Maybe they stop moving. They've been moving and now they're not moving so much anymore. Maybe they're sleeping a lot. And it's not because of a medication. They're just sleeping a lot. Maybe they have a lot of low-grade fevers, nothing major, nothing raging, but just up a little bit. Maybe sometimes you're starting to see maybe more primitive reflexes are coming back. Grasp reflex, bite reflex, rooting reflex, startle reflex. Maybe they're starting to withdraw from everyone, and they're spending much more time with their eyes closed and wanting to be away. Maybe they're drifting in and out. Maybe they've actually said goodbye or they want to go home. If that's the case, then there are many other things. Maybe they're dropping weight. Maybe their wounds are not healing. Maybe they're losing muscle mass. It's time. It's time for us to start these really hard conversations, if we haven't already, that we're probably getting near the end of the disease. And we want to switch gears a little bit. We want to provide good comfort care. We want to make that person as comfortable as possible. So let's talk about what are the things they talked about wanting. What are we not going to fix? But what are we going to do? We're going to fix comfort, but we're not going to maybe fix the infection again. We need to have everybody on the same page, and we want to talk before the crisis, and we want to pull away from the crisis and have the conversation. Because when people are in crisis, they frequently can't process. And this includes caregivers who've been on a long trip and aren't sure whether it's over or not. So what it means is we may decide not to treat the infection, but we want to treat the discomfort. We may want to offer people tastes and sips, but not push nutrition. We may want to think about things other than fluids, like maybe a sip of sherbet, a taste of sherbet, but not water. We may want to look at whether or not touch and massage and movement feels good or it doesn't. And we want to be present. We really want to balance what we offer with sound and touch and movement, and when they need to be left. And left alone. Because they're leaving, and we need to learn how to let go. There's many, many specific skills and tools that can be used, but the first step is recognizing we're reaching the end of the journey. Let's change gears.